to the Medical Terminology Podcast. This episode is Chapter 10, Part 6, Procedures. Fortunately, there aren't too many procedures in this chapter. Most of them we can get using our word parts. There are a few, however, that might be a little tricky, and so I'm going to go over those with you. First of all, I'd like to review the specialties with you because they are terms that people very commonly confuse. And the first two I'd like to look at are psychologist and psychiatrist. Now, a psychiatrist is someone with a medical degree. They're a medical doctor, and they take a biological perspective on treating mental disorders. They generally will employ various drug therapies in order to help patients with mental disorders. On the other hand, a psychologist is someone with a PhD, a doctorate degree, not a medical degree, and they will take a more psychological perspective rather than a biological perspective. And they'll generally employ some forms of counseling or clinical intervention in order to help patients with mental disorders. So the psychiatrist has the medical degree, will usually employ a biological approach to a disease, whereas the psychologist does not. Another pair of terms that are commonly confused are the anesthesiologist and the anesthetist. The anesthesiologist, again, is someone with a medical degree. They've gone on for advanced training in anesthesiology. And the anesthetist is someone with advanced training in giving anesthesia, but who is not a medical doctor. A common example would be a nurse anesthetist. This would be an advanced practice nurse who's gone on for additional education in nursing and giving anesthesia. Okay, now we're going to go ahead and look at the diagnostic procedures. Some of these are really long terms and they can be a little intimidating, but if we use our word parts, we can break them down. The other thing to watch out for is some of them on visual inspection really look similar. So you're going to have to be really careful when you're reading the terms to make sure you're looking at what you think you're looking at. Okay, the first one is carotid ultrasonography. Carotid, C-A-R-O-T-I-D, and that means pertaining to the carotid artery. Ultrasonography, U-L-T-R-A-S-O-N-O-G-R-A-P-H-Y. Now, ultrasonography would be the process of recording using sound. Remember, ultrasound uses high-frequency sound waves. This is an ultrasound procedure. Graphy means process of recording. So what we're doing here is we're using ultrasound to visualize and take pictures of the carotid artery, and that's the major artery that goes up to the brain. And this is a diagnostic procedure for stroke. Again, if you remember, the ischemic stroke refers to a blockage that prevents blood from getting to the brain. Well, this would screen for that. The next one, a little trickier, we got to watch out for. It's echoencephalography. Echo, E-C-H-O, encephalo, E-N-C-E-P-H-A-L-O, and graphy, G-R-A-P-H-Y. It helps if you break it into the parts. Well, echo, again, refers to what? Well, echo, again, would relate to sound. This is going to be another ultrasound type procedure. Encephalo, what does that refer to? Encephalo would refer to the brain. And again, what does that suffix graphy refer to? Well, that's the process of recording, right? So an echoencephalography would be, again, the process of recording the brain using sound, echo. So we're using an ultrasonic procedure to visualize the brain. Now that is different than the next term, which very much looks the same, and that's electroencephalography. They're both really long and they both look very similar, but the prefix at the beginning is different. Electroencephalography begins with electro, E-L-E-C-T-R-O. And you remember what electro refers to. Well, electro is going to refer to electricity or electrical activity. And again, encephalography would mean what? That'd be the process of recording the brain, right? So in this case, an electroencephalography is the process of recording the electrical activity of the brain. We're looking at what's going on electrically in the brain. That's different than getting a visualization of the brain using ultrasound. So watch out for those prefixes. The next term is lumbar puncture. L-U-M-B-A-R, puncture, P-U-N-C-T-U-R-E, more commonly known as a spinal tap. And this is a procedure in which a sample of cerebrospinal fluid is actually removed from the spinal column. It involves making a puncture through the spine into the subarachnoid space and withdrawing some fluid. And the purpose is to diagnose changes in the fluid that might indicate some type of disease. And the final diagnostic procedure is myelography. M-Y-E-L-O-G-R-A-P-H-Y. There's graphy again, process of recording. Myelo would mean we're recording spinal cord, right? In this case, we're doing the recording as a radiograph, as an X-ray, and what we're doing is we're putting a contrast medium into the spinal cord through a lumbar puncture, where instead of drawing fluid out, we're punching and putting it in. We're putting a contrast medium in the spine, and then we're taking X-rays and getting an X-ray picture of the spine. Well, the next area to look at is the area of drugs that affect the nervous system. First of all, analgesic, A-N-A-L-G-E-S-I-C. An analgesic is a drug that reduces pain without affecting consciousness. And we're fairly familiar with analgesics like aspirin, acetaminophen. Those are common analgesics. They reduce pain, but they otherwise don't affect consciousness. A sedative, S-E-D-A-T-I-V-E, produces a state of calm and diminished responsiveness, but without sleep. And finally, hypnotic, H-Y-P-N-O-T-I-C, depresses the central nervous system and it will produce sleep. Okay, I said and finally, but actually our new edition here of the textbook gives us two more types of drugs. It gives us anticonvulsant, A-N-T-I-C-O-N-V-U-L-S-A-N-T, and this is a medication that prevents seizures. Convulsion is like a seizure, so an anticonvulsant is something that prevents or stops seizures. And then finally, it gives us barbiturates, B-A-R-B-I-T-U-A-T-E-S. And barbiturates are a class of drugs whose major action is calming or depressed effect on the central nervous system. Now, in addition to giving us these general classes of drugs, the textbook kind of mixes in some specific examples of drugs. And when you're taking a test, if it's asking you for a class of drug, give the class, not a specific example. If it's asking for a specific example, then give the specific example. Again, you want to be precise in terms of answering the question that's being asked. Okay, they give us a couple of drugs here that are barbitals, or they end in barbital. The lead one is amobarbital, AMOBARBITAL. And since it ends in barbital, that's telling you that it's a barbiturate. And it's a barbiturate that is used as a sedative and as a hypnotic. It has both of those effects. Phenobarbital, PHENOBARBITAL, is another barbiturate. Again, it ends in barbital. And it is also used as a sedative, but it also has an anticonvulsant effect. So the phenobarbital could be used to prevent seizures as well as to calm someone. The amobarbital would be used to calm someone, but it could also have the effect of really depressing the central nervous system and causing sleep. Okay, we've covered quite a few terms. Now it's time to go back and do some practice. Number 1. What is the term for a specialist in giving anesthesia who is not a medical doctor? Well, that would be an anesthetist. 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 What would be the term for a specialist in treating disorders of the nervous system? Well, that would be a neurologist. NEUROLOGIST. And which specialist treats mental disorders using a biological or medical approach? Well, that would be the psychiatrist. PSYCHIATRIST. And which specialist treats mental disorders using an approach that focuses on people's thoughts, feelings, and behaviors? Well, that would be the psychologist. PSYCHOLOGIST. And what degree would you expect the psychologist to have? Well, you'd expect a psychologist to have a PhD, not an MD. And what is the term for a professional in giving anesthesia who is a medical doctor? Well, that's an anesthesiologist. 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 What is the diagnostic procedure that involves using a needle to punch into the spine in order to withdraw cerebrospinal fluid for examination? Well, that's the lumbar puncture. LUMBARPUNCTURE. What is the diagnostic procedure that records the electrical activities of the brain? Well, that's the electroencephalography. ELECTROENCEPHALOGRAPHY. Again, get it by breaking down the word parts. Electroencephalography. Electroencephalography. What is the term for the procedure that visualizes blockages in the carotid artery? That's the carotid ultrasonography. Carotid artery, carotid, C-A-R-O-T-I-D, ultrasonography, U-L-T-R-A-S-O-N-O-G-R-A-P-H-Y. And what is the term for the radiographic study of the spinal cord? Well, that's the myelography, M-Y-E-L-O-G-R-A-P-H-Y. And what is the term for the ultrasound visualization of the brain? That's the echoencephalography, E-C-H-O-E-N-C-E-P-H-A-L-O-G-R-A-P-H-Y. Alright, and what type of drug produces calm, diminished responsiveness without sleep? That's the sedative, S-E-D-A-T-I-V-E. And which type of drug depresses the central nervous system and usually produces sleep? That's the hypnotic, H-Y-P-N-O-T-I-C. And what is the term for a drug that would be used to prevent seizures? That's an anticonvulsant, A-N-T-I-C-O-N-V-U-L-S-A-N-T. And what is a class of drugs whose major action is calming and producing a depressing effect on the central nervous system? Well, those are the barbiturates, B-A-R-B-I-T-U-R-A-T-E-S. What type of barbiturate might be used to prevent seizures? Well, that's phenobarbital, P-H-E-N-O-B-A-R-B-I-T-A-L. What type of barbiturate might be used as a sedative or hypnotic? Well, that's amobarbital, A-M-O-B-A-R-B-I-T-A-L. Well, okay, this is a really long chapter, but we've come to the end of hitting the high points. Again, there are many other things in there that you need to study. Most of them you can get with the word parts. Again, the focus here is always on the more difficult terms, those that people tend to confuse or miss on tests. Well, good luck in your studying. Once you get done with chapter 10, you can pat yourself on the back again because now you're 2/3 of the way through the class. You only have 5 more chapters to go. This ends this episode of the Medical Terminology Podcast.